This video was created for the purpose of bringing hope to the millions who suffer needlessly from the diseases of modern civilization. If you or a loved one suffers from a chronic health condition such as diabetes, arthritis, fibromyalgia, depression, or anxiety, that condition is similar to having a weed in a garden. Left unchecked, chronic health conditions suck away your vitality and destroy your quality of life. Just like weeds that are ignored will eventually choke out desirable plants, so they must be removed. One way to remove a weed is to spray an herbicide. This quickly kills the weed, but it also poisons the soil and surrounding plants. Furthermore, the roots of the weed often remain unharmed even though the plant appears to be dead. There's strong chance that the weed will regrow again. Now compare poisoning a weed to digging it up by its roots and removing all traces of the weed so that it never grows again. Of these two ways, which is the most effective and healthy way to take care of the weed? Most modern medical procedures focus on poisoning, chemically manipulating, or cutting out the effects of chronic illness through the use of pharmaceutical drugs and surgery, rather than identifying and removing the root cause of the problem and allowing the body to return to its natural state of balance. What would you prefer if you knew you had the choice? For example, observe a patient that is diagnosed with hypertension. Modern medicine prescribes medications to lower your blood pressure, medications that have potentially dangerous side effects that can be worse than the problem they are treating. Typically, the doctor does not investigate why the blood pressure is high, and the patient becomes forever dependent on potentially toxic medications to keep his or her blood pressure in the normal range. High blood pressure is not a natural state and certainly is not caused by a drug deficiency. It is a sign that the body is out of balance or in a state of disease. Disease is a natural consequence of an unnatural environment. Once balance is reestablished, blood pressure will normalize and the need for medication will disappear. So what needs to change for all of this to happen? In this video, we're going to introduce you to another way of approaching the treatment of chronic disease by going to the root cause and correcting what has caused it. This approach is called functional medicine or functional wellness. Functional wellness is about creating health, vitality, and balance without pharmaceutical drugs or surgery. To do this, there has to be a clear understanding of each individual's current state of health and the factors that influence their health. This begins with the triangle of health. At the center of the triangle, you have your DNA, the genetic code that contains the blueprint that ultimately becomes you. You cannot change your DNA or alter it. The DNA you were born with is the DNA you will have for life. However, numerous environmental factors can affect how your genetic code expresses itself. The effect the environment has on your DNA is called epigenetics and can influence your DNA in either a positive or negative way. There are three key environmental factors that affect your DNA. They are mental, physical, and chemical. Let's start with the mental, as it refers to your thoughts and emotions. Your mental or emotional state can influence how certain genes are turned on or off. For example, if you're going through a very stressful period in your life resulting from job dissatisfaction, relationship challenges, financial worries, or the death of a loved one, these mental elements can negatively trigger your DNA to express a variety of potential diseases. The goal of any effective health plan is to incorporate procedures that have positive effects on your mental well-being, your health, and your DNA. The next environmental factor is physical. There are numerous physical irregularities that can influence the DNA. For example, scientists at Lund University in Sweden have studied and observed positive epigenetic changes in genes linked to type 2 diabetes and obesity as a result of physical activity, even in small doses. Conversely, lack of exercise can turn on certain genes that promote diabetes, cancer, and even Alzheimer's disease. There are many ways physical attributes can influence DNA in either a positive or negative manner. Finally, we have the chemical side of the equation. Chemistry relates to those factors and substances that the body comes in contact with that can either have a positive or negative effect on your DNA. Good nutrition is an example that has a positive effect on your DNA, whereas water and air pollution are chemical influences that have an overall negative impact on your DNA. By being aware of and identifying the environmental factors that are contributing to disease, we can then remove those factors and introduce protective strategies that turn on the genes that support us and turn off the genes that don't. Now that you see how all three sides of the triangle of health, the mental, the physical, and chemical, affect the DNA, there's one more element that needs to be explained. These three environmental factors do not act in a vacuum. They, in fact, influence each other. The mental component affects the physical component affects the chemical component, and the chemical component affects the mental component, and vice versa. Each of the components feed into each other. If you're like most people, you've previously had someone address your chemistry. In other words, you've likely been put on different medications. These medications act to chemically manipulate or mask your disease symptoms, or even poison your body, but they do not address the underlying mental, physical, and chemical factors that caused the disease to begin with. For this reason, their effectiveness is often short-lived, and in fact, long-term use will often negatively impact your health. Pay attention to drug advertisements and the list of side effects that are disabling and can even result in death. In fact, prescription drugs are now the fourth leading cause of death in the United States. An example of chemical manipulation would be prescribing a synthetic drug to a diabetic to improve insulin sensitivity. This treatment, while effective for some in the short term, does not address why a patient is insulin resistant in the first place. Metformin, for example, has over 50 possible side effects, including one serious side effect that results in death in 1 out of 2 people. Why would anyone expose themselves to the toxic side effects of a synthetic drug if a natural, non-toxic solution was available? Most people have only had abnormalities in the triangle of health addressed through pharmaceutical drugs or surgery, which equates to poisoning or cutting a weed, leaving its roots to grow again. To successfully treat and overcome disease, we need to identify and get a thorough understanding of the mental, physical, and environmental abnormalities that underlie the disease, and then design a treatment or wellness plan to correct any abnormality at its root. This approach leads to a much higher probability of long-term success. Getting to the root of the problem starts with a comprehensive evaluation and testing procedure that looks at the whole person and how they are adapting to their environment. Only then can the root cause be determined to allow for the next step, healing. Most physicians don't typically look at the whole person, and they perform only a handful of tests based on the patient's symptoms, whereas a functional wellness approach is much different and digs far deeper, often testing hundreds of factors that could include a complete blood workup to identify health trends and deficiencies, saliva testing to accurately evaluate hormone levels in the body, a comprehensive gastrointestinal gut profile that identifies weaknesses in the immune system and verifies food and environmental allergies, and examining the entire body to determine any structural irregularities that could cause metabolic interference. It's only by viewing the whole person and having a complete picture that any meaningful progress can be made and then measured. Testing, tracking, and then having the knowledge of how to effectively utilize that information is critical to being able to prioritize the next step of the healing process. Many individuals who approach their health from a functional wellness perspective succeed in reaching their health objectives even beyond their wildest expectations. There are also those that have not done well. When we analyze the reasons for success and failure, it comes down to understanding what attributes an individual must possess if they're going to succeed with a natural approach to their health. Those that reach their health objectives all have the following attributes. They realize that whatever they have been doing to manage their health is not working. They have a burning desire to make whatever changes are necessary to break free from the bondage of ill health and resolve their difficulties. This must be a burning desire. A casual desire will not cut it. They are willing to invest time, energy, and money in themselves to make the necessary changes. They are willing to make a long-term commitment to educate themselves and ultimately change their behavior in order to turn their health difficulties around. And finally, they are honest individuals and follow through on what they say they're going to do. Do you have these 5 attributes? If so, you are ready to take charge of your life and your health destiny.